It is that time of the year again. The ICD-10-CM code set is getting its facelift for the next fiscal year. There are many changes for 2024, mainly the addition of new codes, but there were also some modifications made to the index and the tabular. Because there is so much to review, the updates will be addressed in 3 parts. First, the formal changes to the index and the tabular, then the code changes affecting the most commonly coded conditions, and finally, everything else. So what is changing? We have almost 400 new codes for 2024, 12 revisions, and 25 code deletions. These changes, of course, also resulted in some of the guidelines to be revised. In addition, we have a lot of changes in the index and the tabular, and we will start there. As part of the tabular revisions, many changes were made to the excludes nodes. Here we can see an example where the block of sexually transmitted diseases A50, A64 had its excludes 1 instructions modified. In 2023, we had 3 codes that could not have been coded together with anything within this block, but for 2024, HIV disease is taken out of the excludes 1 group and categorized as an excludes 2. So while in 2023, AIDS could not have been coded with syphilis, for example, A50, in 2024, we can assign these 2 codes together. Another example is shown here, this time for a single code. Under code K514, all the excludes 1 nodes were moved from an excludes 1 status into an excludes 2 status. Again, what it means that what we couldn't code together previously, for example, an inflammatory polyp and an unspecified polyp, can be coded together in 2024. Other changes in the tabular include modifications to instructional nodes. For example, category A41 other sepsis had a code change for post-procedural sepsis from T81.4 to T81.44. In addition, there is a new code that needs to be coded first if applicable for sepsis due to central venous catheter. And finally, we also see a change in the list of other codes that may have to precede A41 in the next year for sepsis following abortion, ectopic or molar pregnancy, or therapeutic injection, transfusion, and infusion. Notice how the codes are different for 2024. Further example for instructional node change is code I87.2 venous insufficiency. In the future, we are to assign a separate code for any ulcer associated with the insufficiency, plus a hypertension code if applicable. Besides the tabular, the index had extensive changes done to it as well. An example which is probably relevant to all of us is the index entry for strokes. For 2024, the sub-entry of cerebral was removed. It should be here, but it isn't. And the non-essential modifiers for cerebrovascular accident were changed. The specificity embolic and thrombotic are moved from a non-essential modifier position into their own index entries. Notice that the coding has changed as well. These types of strokes are no longer defaulting to the unspecified code I639. Now we will have a choice. Also, we have a new entry here for chronic, old or remote stroke with or without late effects. This entry was not present in 2023. The external cause index was also revised. Many of the changes in here relate to newly added codes. We will review those later in the 3rd part. For now, let's just notice the 2 new place of occurrence codes and the main term revision for prolonged sitting. The Neoplasm table has 1 new change. Code D139 was revised to D1399 to describe other benign neoplasm of the digestive system. The inclusion terms are especially useful to remember: benign neoplasm of intestine NOS, or benign neoplasm of spleen, benign neoplasm of digestive system NOS. And finally, the drug table also has a new code: toxic effect of gadolinium. Gadolinium is a rare earth mineral used as contrast media to enhance MRI imaging. While it is usually considered safe, some patients can have serious side effects or even die from gadolinium toxicity. Because of this, it was important to establish a code to be able to recognize, diagnose, and treat patients properly and in a timely manner. The moral of the story so far is that extensive changes were made to the 2024 code set, so we cannot really code from routine anymore. There are a lot of things that we need to relearn, the instructional nodes, the excludes nodes, how to code acute strokes, polyps, sepsis, etc. And we also have to remember a lot of new instructions and additions in almost every chapter. Next, we will have a look at code changes. We will start with the ones most affecting our daily work, then we'll briefly mention the rest. Also, where applicable, we will have a look at the related guideline changes, index changes, or whatever else is necessary. See you in the next part, over here.